Cigarettes aren't good for us. That's hardly news. We've known about the dangers of smoking for decades. But how exactly do cigarettes harm us? Let's look at what happens as their ingredients make their way through our body and how we benefit physically when we finally give up smoking. With each inhalation, smoke brings in more than 5,000 chemical substances into contact with the body tissue. From the start, tar, a black resinous material, begin to coat the teeth and gums, damaging tooth enamel and eventually causing decay. Over time, smoke also damages nerve endings in the nose, causing loss of smell. Inside the airways and lungs, smoke increases the likelihood of infection as well as chronic disease like bronchitis and emphysema. It does this by damaging the cilia, tiny hair-like structure whose job it is to keep the airways clean. It then fills the alveoli, tiny hair sacs that enable the exchange of oxygen and carbon dioxide between the lungs and blood. A toxic gas called carbon monoxide crosses the membranes into the blood, binding the to hemoglobin and displacing to the oxygen it will usually have transported around the body. That one of the reasons smoking can lead to oxygen deprivation and shortness of breath. Within about 10 seconds, the bloodstream carries a stimulant called nicotine to the brain, triggering the release of dopamine and other neurotransmitters, including endorphins, that create the pleasurable sensation which makes smoking highly addictive. Nicotine and other chemicals from the cigarette stimulant cause construction of blood vessels and damage their delicate endothelial lining, restricting blood flow, thus vascular eviculates to tightness of blood vessel walls, and enhance blood flatness thickness, increasing the likelihood that clots will form and trigger heart attack and strokes. Many of the chemicals inside cigarettes can trigger dangerous mutations in the body DNA that make cancer form. Additionally, ingredients like arsenic and nickel may disrupt the process of DNA repair, thus compromising the body's ability to fight many cancers. In fact, about one every three cancer deaths in the United States is caused by smoking. And it's not just lung cancer. Smoking can cause cancer in multiple tissues and organs, as well as damage eyesight and weakness bone. It makes it harder for women to get pregnant and in men can erectile dysfunction. But for those who quit smoking, there's a positive upside with almost immediate and long-lasting physical benefit. Just 20 minutes after a smoke final cigarette, their heart rate and blood pressure begin to return to normal. After 12 hours, carbon monoxide levels stabilize, increasing the blood oxygen carrying capacity. A day after casing, heart attack rates begin to decrease as blood pressure and heart rate normalize. After 2 days, the nerve endings responsible for smell and taste start to recover. Lungs become healthier after about 1 month, with less coughing and shortness of breath. The delicate hair-like cilia in the airways and lungs start recovering with weeks and are restored after 9 months, improving resistance to infection. By the 1 year anniversary of quitting, heart disease risk plummet to half as blood vessel function improves. 5 years in, the chance of clot forming dramatically declines and the risk of stroke continues to reduce. After 10 years, the chance of developing fatal lung cancer go down by 50%, probably because the body ability to repair DNA is once again restored. 15 years in, the likelihood of developing coronary heart disease is essentially the same as that of a non-smoking. There's no point pretending this is all easy to achieve. Quitting can lead to anxiety and depression resulting from nicotine withdrawal, but fortunately side effects are usually temporary. And quitting is getting easier thanks to a growing arsenal of tools. Nicotine replacement therapy, nicotine skin patch, lozenge, and sprays may help with smokers of cigarettes. They work by stimulating nicotine receptors in the brain and through preventing withdrawal symptoms without the addition of the harmful chemical. Counseling and support group, cognitive behavioral therapy, and moderate intensity exercise also help smokers stay cigarette free. That's good news. Science quitting puts your body on the path back to health. construction of shit, bro. The likelihood the cloud